project, which is called The Effects of Curcumin in Pain Relief in Women Diagnosed with Primary Dysmenorrhea. It's a triple-blinded, placebo-controlled phase 2 randomized clinical trial and is going to be registered as the SCAPE pain trial.
Despite it had been used for centuries for its medicinal effect, it hasn't been until recently where the scientists have demonstrated that curcumin has some anti-inflammatory effect. Hence the purpose of our project. We are trying to see if those anti-inflammatory effects would have positive impact over the symptoms of primary dysmenorrhea.
Our first goal in this placebo-controlled clinical trial is to evaluate if curcumin is effective on pain reduction. Also, we want to determine if it can be well tolerated and observe possible side effects.
Concerning the trial design, it will be a single center, randomized, triple-blinded, parallel group, placebo-controlled, phase 2 trial to evaluate the superiority of curcumin over placebo.
Regarding the inclusion criteria of our study, we will include all women between 18 and 35 years old diagnosed with primary dysmenorrhea. All will have to agree to participate in our study in a voluntary way and sign informed consent.
The main exclusion criteria of this trial are secondary dysmenorrhea, concurrent life-threatening condition or progressive CNS disorder, concurrent diagnosed diabetes or hypertension, pregnancy or intent to get pregnant.
Have 80% power, a sample size of 90 patients will be required to detect a 40% difference in BAE score from baseline using an ampere t-test with a 0.05 two-sided significance. Allowing a 20% loss to follow-up, we will need a total sample size of 112 participants, 56 in each group.
Participants in the intervention group will take oral curcumin 500 mg capsule every 12 hourly, starting 7 days before the start of their menses expected date and continuing to 2 days after the menses begin, and this will go on for 4 consecutive menstrual cycles.
For primary outcome, we're going to use ampere t-test, and for the secondary outcome, we're going to use for categorical variable, chi-score test, and for continuous variable, ampere t-test. The p-value will be set on 0.05.
The primary outcome, we plan to use visual analog scale for pain, and the secondary outcome, adverse effects of curcumin, Cox menstrual symptom scale, and the use of rescue drug.